Hello. In this video, I will be highlighting the underrepresented areas of healthcare part of the Health and Wellness exhibit in the Chaska Historical Society. Certain areas of healthcare have long been undervalued. Women's health and mental health are two of those areas which are finally, albeit slowly, gaining needed attention and acceptance. Women's healthcare. In the late 1800s and earlier, it was commonly believed most women's ailments were caused by the reproductive organs, or most likely mental disorders. Women were seen as weak, childlike, fragile, and prone to hysteria. Giving birth was often feared by women in the latter part of the 19th century because of concerns for infection, puerperal fever, or childbed fever, which leads to sepsis and death, hemorrhage, pain, and tearing. Religious zealots fought against the use of pain relievers in childbirth because women were cursed and were to endure the pain of childbirth. During the 1960s, the civil rights and women's rights movements led to the women's health movement. By 1983, the NIH was funded to include more research regarding women's health issues. By 1984, these studies were to include the reproductive and health of African American women. By the 21st century, women were included in half of the NIH studies. Women's healthcare has come a long way with the development of antibiotics, hormonal treatments, safe deliveries, preventative screenings, and major advances in treatments for women's medical issues. Also, there are more women healthcare providers who understand what their patients are experiencing. Here is a fetal stethoscope that was a specialized stethoscope used to closely monitor the heartbeat and well-being of a fetus. Here is a cervical dilator. Mental health care. Historically, mental health concerns were often seen as character flaws rather than as legitimate illnesses, and treatment, if any, often consisted of self-medicating with alcohol or other drugs. Concerns were not always discussed even among family members. However, mental health issues have always existed. A combination of genetic factors and of specific events, such as major personal losses, war, or monetary issues, have meant that depression, anxiety, psychosis, and other concerns have long been ignored or inaccurately treated. Those living with mental health concerns have often been outcast or inappropriately hospitalized and/or medicated. Between 1873 and 1959, obituaries for 20 suicides were published in the local newspaper. The majority occurred from 1873 to 1912 and included men and women from age 19 to 87. Information regarding these were included in articles. Mental despondency was stated as a factor multiple times. Occupations varied from farmer, policeman, cattle buyer, and housewife. These 20 suicides were acknowledged. It is not known how many were not acknowledged. Today, the physical causes of mental illnesses are increasingly coming to light. And, with that knowledge, greater understanding and hope. Thankfully, compassionate and appropriate care is more readily available than ever before. Magdalena Lubansky, Chaska midwife, women's healthcare pioneer. In 1890, Magdalena Lubansky completed her schooling and training in St. Paul and received her license to practice as a midwife. She was 32 years old and a wife and mother and would herself have 10 children. Lubansky would practice in Chaska and the surrounding rural areas for the next 49 years. Her grandson, Jerry, would often be told by others that his grandmother, Lubansky, had delivered the speaker, his/her son or daughter, or all part of their family. It is a blessing for Chaska she became a midwife, and impossible to know just how many babies she delivered. Lubansky's son, Kashmir, Luby, recalled to Jerry how often a farmer would stop at their house to pick her up, and she would go and prepare his wife and home for the birth of their child. After delivering the baby, tending to the mother and newborn infant, and getting them situated for their new lives together, she would return home usually 2 or more days after departing. Her fee might be $1 or a bag of corn or other food items. Thank you for watching.